I will show 3 cases of subchorionic hemorrhage, beginning with this 34-year-old gram-multipara who presented at 12 weeks of gestation with bleeding per vagina. She had episodes of miscarriages and an antepartum hemorrhage which required multiple transfusions. From the history obtained, previous ultrasound scan images also revealed retroplacental clots. This pregnancy also ended in a miscarriage. So this is a case of bad obstetric history. This is the video of the subchorionic hemorrhage. Here is the bladder, the vagina, the cervix, and the uterine cavity. Generally, subchorionic hemorrhage is said to be small if it is less than a third of the chorionic sac diameter. It is moderate if it is 50% of the chorionic sac diameter, and it is large when it is greater than 2/3 chorionic sac diameter. So in this patient, let's see the type of subchorionic hemorrhage we are dealing with. Here you can see this is the myometrium here, and this is the subchorionic hemorrhage. As you can see, this is greater than 2/3 of the chorionic sac diameter. So this is a large subchorionic hemorrhage. Large subchorionic hemorrhage is associated with significant pregnancy loss, as happened in these patients, associated with fetal growth restriction, preterm birth, PRH, and abruption. Note the color box and the lack of color uptake by the hematoma. Hematoma is not a live tissue and therefore will not take up color. This is the transvaginal image. This is the myometrium, anteriorly of the cervix, posteriorly of the cervix, cervical canal, internal os, and with not the large subchorionic hemorrhage. Spontaneous recurrence rate is 18.8% in cases of large subchorionic hemorrhage. This patient had spontaneous miscarriage. Subchorionic hemorrhage located in the fundus carries higher risk than that located around the cervix. Subchorionic hemorrhage could be confused with death of a second twin, and therefore is an important differential diagnosis. Let's see the transvaginal video. Internal os, cervical canal, anteriorly of the cervix, posteriorly of the cervix. Look at this large subchorionic hemorrhage. The pregnancy ended in spontaneous miscarriage. This is the second case, also in the first trimester of pregnancy. This is the bladder. This is a hematoma here. And look at the chorionic plates and the live fetus. Here you can trace the myometrium here and the subchorionic hemorrhage here. Again, you can see the myometrium here and the subchorionic hemorrhage here. It continues up to here. So this is moderate subchorionic hemorrhage. This was at 30 weeks of gestation. The myometrium, the chorionic plate, and the subchorionic hemorrhage. Sub-Chorionic hemorrhage. So this is small sub-chorionic hemorrhage. So here the Mickey Mouse appearance of two arteries and a vein. This was a case of vanishing twin syndrome, followed up from the first trimester up to the second trimester. This is an important differential diagnosis of subchorionic hemorrhage. Thank you.